Shocking truth. There's a silent culprit inside your body that could be the root cause of both heart attacks and strokes, and almost no one is talking about it. It's not cholesterol. It's not high blood fat. What you're about to discover comes from a part of the body that seems harmless, yet it may silently push you toward disaster. And I'm not speaking theoretically. I almost lost my life because of this. So stay with me to the end. Let's start with what I call undeniable evidence. Multiple medical studies have revealed a shocking pattern. In a significant number of patients who suffered heart attacks or had blocked coronary arteries, scientists found bacterial DNA, specifically from root canal-treated teeth, inside their arteries. Sounds hard to believe, right? But it's true. And what's even more alarming is that these oral bacteria have also been found inside blood clots of stroke patients. So here's the big question. How do bacteria from the mouth end up in the heart or the brain? What's their path of invasion? It turns out the connection between oral health and cardiovascular diseases like heart attack and stroke is becoming stronger and clearer than ever. Let me share a very real, very personal story. Not long ago, I went in for a routine dental checkup, but this time the clinic used a 3D cone beam scan, a powerful imaging tool that allows dentists to detect hidden infections deep around the tooth roots, even those missed by standard X-rays. When the results came in, I was shocked. A dark circular area showed up around the base of a tooth. Turns out it was a silent abscess, slowly eating away the bone beneath it. And here's the scary part. I had no symptoms, no pain, no swelling, no sensitivity, nothing. What I realized later was, I'm not alone. After reading hundreds of comments from viewers, I saw a pattern. Many people had unexplained health problems, chronic fatigue, autoimmune symptoms, even heart issues, only to later discover they had hidden oral infections quietly wreaking havoc in the background. According to medical experts studying this field, chronic low-grade infections in the mouth, even when painless, can trigger systemic inflammation. One of the most common culprits? Chronic apical periodontitis, a long-term infection that develops around the root of a dead tooth after a root canal, usually without obvious signs. And here's the key mechanism. Every time you chew, the pressure may push bacteria from these hidden infections deeper into the lymphatic system, allowing them to circulate throughout your body. That's how these oral bacteria can end up in your joints, your bloodstream, your heart, or even your brain, possibly playing a role in everything from autoimmune flare-ups to cardiovascular complications. Every year, millions of people undergo root canal treatments. But here's a compelling hypothesis. The complex microscopic structure of the root canal system makes complete sterilization nearly impossible. At the same time, the tooth's natural immune defense is removed during the procedure, turning the area into a safe haven where inflammation-resistant bacteria can persist, undetected, for years. This may explain why the rate of dental abscesses and chronic inflammation is significantly higher in root canal-treated teeth. Even more concerning, many of these patients also present with cardiovascular complications. The silent danger, hidden in your jaw. These infections often go unnoticed on traditional X-rays and are only revealed through cone beam CT scanning, an advanced imaging technology that provides high-resolution 3D views deep into the jaw and surrounding bone tissue. Countless people have shared their experiences. They suffered for years with vague but persistent symptoms, chronic fatigue, joint pain, widespread body aches, even mild neurological issues like brain fog. Most of them were told, it's all in your head. Until one day, a hidden oral infection was discovered, and everything suddenly made sense. So how can you know if this is happening to you? One of the most effective tools is a CRP blood test. C-reactive protein, a biomarker that detects systemic inflammation. Hidden infections may be lurking in old root canal teeth, gum pockets, deep jawbone tissue, or even in tonsils, and you may have no idea they're there. The situation becomes dangerous when your immune system weakens and can no longer control this silent bacterial invasion. These pathogens create oxidative stress, an imbalance between free radicals and antioxidants, leading to cell damage throughout the body. Keep in mind, your mouth is a microbial ecosystem, home to more than 500 species of bacteria, viruses, and fungi. When toxins from these microbes escape into the bloodstream, they can trigger widespread immune responses, leading to inflammation in other organs, joints, heart, even the brain, inflammation, and blood clots. The hidden connection. When the body faces chronic, low-grade inflammation, one of its most common biological responses is to form blood clots, a key mechanism directly linked to the risk of heart attacks and strokes. So if you've been feeling constantly tired, noticing weaker immunity, or suspect you're experiencing oxidative stress, that dangerous imbalance of free radicals, it may be time to ask, where should you start? One helpful suggestion is to take liposomal vitamin C at a dosage of around 1 to 2 grams per day. This isn't your typical vitamin C used just for general nutrition. It's a powerful antioxidant with the ability to penetrate cells, neutralize free radicals, and reduce cellular damage caused by inflammation. For optimal results, it's best to divide the dosage throughout the day. For example, 500 milligrams taken several times daily. Since vitamin C is water-soluble, your body benefits more from a consistent level in the bloodstream. One major advantage: liposomal vitamin C doesn't typically cause digestive upset or diarrhea, unlike some high-dose conventional forms. However, let's be clear, liposomal vitamin C is not a cure for infections or heart disease. It's a supportive tool, one that can help your body recover more efficiently and reduce systemic oxidative stress. If after using it for a period of time you notice significant symptom improvement, it may be a sign to dig deeper, reassess your diet, sleep quality, stress levels, or even investigate hidden dental infections as a possible root cause. Now, let's talk about options when a tooth becomes infected, especially one that has already undergone a root canal but is still causing issues. This is a critical decision that should be made carefully, ideally in consultation with a skilled biological dentist or a holistic health expert familiar with these connections. Here's the core issue. The root canal system is made up of microscopic, intricate tubules. Completely sterilizing these canals is nearly impossible. Even if the initial treatment appears successful, bacteria can remain in the tiny dentinal tubules and continue to cause low-grade infections, sometimes for years, releasing toxins into the bloodstream, triggering immune responses, and contributing to chronic inflammation. So, when should you consider tooth extraction? You might want to seriously consider extraction if you have a root canal-treated tooth and you're experiencing persistent or dull lingering pain in the area. Imaging results, especially cone beam CT scans, reveal a recurrent infection or abscess. Or you're dealing with chronic health issues such as fatigue, joint pain, or systemic inflammation with no clear cause, and you suspect that tooth may be a contributing factor. In such cases, removing the compromised tooth could be the right move. Many individuals have reported remarkable improvements in their overall health, energy levels, and even mood after removing a dead tooth that was silently wreaking havoc in their system. What are your restoration options after tooth extraction? There are 3 main solutions you can consider. 1. Dental implants. This is the most popular choice due to its aesthetic appeal and durability. However, it's important to pay close attention to the materials used. Zirconia implants, ceramic-based, are considered more biocompatible and may be better tolerated by individuals with sensitivities compared to traditional titanium implants. That said, implants tend to be more expensive and require good jawbone health for proper integration. 2. Dental bridge. This option involves shaving down adjacent healthy teeth to anchor the bridge. It's often selected when implants are not feasible due to bone loss or when the patient prefers a lower-cost solution. However, it does involve compromising nearby teeth, which might not be ideal in the long term. 3. Removable denture. This is the most budget-friendly option. It's non-invasive, but may come with discomfort during chewing and require extra hygiene care. Some patients also find it less aesthetically pleasing or less stable than fixed options. Whichever solution you choose, it's essential to consult with your dentist carefully to find the best fit based on your oral condition, health goals, and budget. How to find the right dentist. Look for a holistic dentist, a professional who understands the connection between oral health and overall well-being. Don't hesitate to ask about their experience dealing with chronic infections and the materials they typically use for implants, fillings, and restorations. A knowledgeable and open-minded provider can make all the difference in your health journey. Another major challenge is the cost of dental care. Unfortunately, many dental treatments are not covered by health insurance, leaving countless people unable to access the care they need. This highlights the importance of reevaluating how we value oral health, not as a cosmetic luxury, but as an essential part of overall health. So, what can we do to reduce hidden oral health risks that affect the rest of the body? Practice proper daily oral hygiene. Make brushing your teeth at least twice a day a non-negotiable habit. Use floss daily to clean between your teeth, areas your toothbrush can't reach. A high-quality mouthwash can also help reduce bacteria and protect your gums. Eat a whole food, anti-inflammatory diet. Avoid excess sugar and ultra-processed foods, which fuel inflammation and encourage harmful bacteria to thrive in your mouth. Instead, load up on leafy greens, fresh fruits, and nutrient-rich whole foods. These support not just your teeth, but your entire body. Schedule regular dental checkups. Don't wait until you're in pain. Visiting your dentist every 6 months allows for deep cleanings and early detection of hidden infections before they become serious problems. Be informed and cautious about procedures. If your dentist recommends a root canal, take time to research. Consider getting a second opinion and choose a provider with advanced experience, preferably someone who uses modern diagnostic tools like cone beam CT scans to uncover hidden issues. Of course, this is just a brief overview of a much deeper and important topic. We encourage you to keep learning from credible medical and dental sources. And if you've had personal experiences related to this, feel free to share them in the comments. Your story might inspire or help someone else going through something similar. Final note: everything shared in this video is not a substitute for professional medical advice. Always consult with your physician or dentist before making any treatment decisions. Thank you so much for watching until the end. Stay well and take care of your smile because it's more powerful than you think.